Good afternoon, everyone. Today with us is Dr. Ranjitha. She is from Hyderabad, an MPT musculoskeletal and sports yoga instructor and diabetes educator. Today, she will share the power of yoga, how yoga can help to cure type 2 diabetes. Welcome, ma'am.
So, shall I start, sir?
Yes, ma'am.
Good afternoon, everyone. So, my name is Ranjitha. I am physiotherapist and a yoga instructor, and also I will be giving diabetes counseling to the people who are with type 2 diabetes. And this approach is a integrated approach. So, it is not only with the medicines, with the help of yoga and also with the nutrition, we can reverse diabetes and also we can reverse the complications to some extent. Today we will see about the importance of yoga for type 2 diabetes. So, shall I start, sir? Diabetes is a disorder in which body fails to take glucose from the blood. So, there are two types of diabetes in our body, type 1 and type 2. Type 2 is the diabetes is a disorder in which body fails to take glucose from the blood. So that means when we eat food, so the food that enters into our stomach, so when it reaches the stomach, then to intestines, digestion takes place. So when digestion process takes place, the glucose is liberated into the blood. So the glucose in the blood is not able to go into the cells. So the cells can't meet the energy needs, and energy is taken up from the fats and proteins. So using fat as an energy source, it results in increase in ketones in the body. With the usage of protein in the patient feel tired and sluggish. So here what happens? The glucose present in the body, that is in the blood. So instead of the glucose will remain in the blood itself. So how the energy should come from the food. So as a result, the glucose present in the blood, it is converted into ketones. Ketones are highly toxic to our body. So these ketones are from the fats which are present in the food. From the fats, it is synthesized into ketones. So with ketones again, the lactic acid is generated. With this again, there will be sluggishness will be there, fatigue will be seen. And with the usage of protein from the food, the patient feel tired and sluggish. So if not sufficient protein is present in the food, the patient will feel tired and sluggish. So if blood glucose is high, so the glucose is not synthesized in the blood from the blood, so it remains in the blood. So as a result, the glucose remains high in the blood. So this glucose enters into the first organ is kidneys. So it is tried to be thrown away by kidneys. So the patients begin to urinate so often. So this glucose is transported to the kidneys. In the kidneys also, the glucose level will become high, and as a result, the kidney starts to urinate so often. As a result, the patient feels thirsty. Once the frequent urination takes place, the patient starts feeling thirsty and starts to drink a lot. So these
Ma'am,
are
I
the
have one
some.
question over here.
Yes, yes, sir.
Which diabetes, type 1 diabetes or type 2 diabetes, which diabetes is more dangerous?
Sir, it is type 1 diabetes is more dangerous than type 2. Type 1, now I will explain. There are two
Okay.
types of diabetes after this. Type 1 is from the childhood it will be seen. Type 2 is from the environmental factors or because of stress also we can get diabetes. Because of hormone disturbance also we can get diabetes. Metabolic complications also we can get diabetes. This is type 2. This is acquired type. Type 1 is childhood. From the childhood only we will be seeing this diabetes. So these are the some of the complications which I am showing you. The blue one is of type 1 diabetes, black one is type 2 diabetes. So in the
Okay.
eyes we can see diabetes retinopathy with type 2, and breathlessness. Sometimes if many of us, if we feel stress and anxiety, we can see anxiety, there will be breathlessness can be seen. And in type 1 people we can see the smell of acetone, means bad odor can be seen from the mouth and also from the breathing. When it comes to
Okay.
stomach, there will be nausea, vomiting, abdominal pain. These are the symptoms we'll be seeing with the increasing diabetes. Polyuria means increase in urine, urgency of urine. Polyuria, going urine many times. Glycosuria, in urine also we can see glucose. And in respiratory,
Okay.
this is seen in type 1. Kusumal breathing means that is breathing with sound. This can be seen in type 1. And weight loss. Weight loss can be seen more in type 1 than in type 2. In type 2, obesity is seen more than in type 1. Then in the nervous system, polydipsia, polyphasia, lethargy means unable to do any work. So if the
Okay.
patient wants to do, the diabetic people want to do any work also, they will feel very lethargic, stupor.
Okay.
So these are the some of the complications, some of the symptoms with type 2 diabetes. So coming to
Okay.
types, two types of diabetes are seen, type 1 and type 2. So type 1, it is the childhood diabetes. It is an insulin dependent. It is also called as insulin dependent diabetes. Type 2 is non-insulin dependent diabetes. Now we will see what is type 1, what is type 2. So in type 1 diabetes, body stops making insulin. So this insulin is an hormone. It is an present in the pancreas. From the pancreas, the insulin is secreted. So in type 1 the diabetes, body stops making insulin because the body immune system destroys the insulin producing cells called beta cells. These beta cells will be present in pancreas. So these beta cells only produce insulin. So it is not produced in the body in type 1 diabetes. People with type 1 diabetes need to take insulin injections every day. So this there will be many complications, and we have to take utmost care, and regular monitoring should be there. Even the diet also they have to take in control, and the lifestyle also they have to change, the type 1 people. Otherwise they will end up into death in very early stage only. Although it can occur at any stage, this type of diabetes occur more often in children and young adults. So that is why. So we can see this type 1 diabetes from the age of 5 years or from the age of 10 years also we can see this type 1 diabetes. Type 2 diabetes, it is also called because of obesity. We will be seeing nowadays. Type 2 diabetes occur when your body cannot use insulin properly. So once food enters into our body, the pancreas will release the insulin. So here the body will not utilize the insulin in type 2. In type 1 what? The body itself does not produce insulin. Here the insulin is produced but the cells will not take the insulin properly. So this is called as insulin resistance, or it does not make enough insulin also. This type of diabetes is usually seen in adults who are overweight and less active. So, who are in obesity and who are less active, not doing any exercises, lethargic, and their lifestyle is like that. In those people, we will be seeing this type 2 diabetes, and this is commonly seen after 30 years of age only. Whereas in type 1 diabetes, we can see from childhood itself. So, due to obesity and inactivity, this type of diabetes is increasing in children. So, nowadays, this type 2 diabetes is also seen in children with more than 12 to 15 years of age, also. So, we will not consider it as type 1 diabetes. We will consider it as type 1 diabetes rather than type 2. Type 2 will be seen only after 30 years of age only.
Okay.
So what are the symptoms of type 2 diabetes? Frequent urination, excessive thirst, excessive hunger will be there, frequent hunger, tiredness, lack of interest and concentration, numbness in feet or in hands, and blurred vision. This blurred vision can be seen in when there is a severe high in glucose levels in the blood. Then only we can see this blurred vision. So what are the recommendations for this diabetes? So there should be a holistic approach should be there. So diet therapy, exercise therapy, and pharmacotherapy is the drugs what we have to use. So these three should go hand in hand. Then only the diabetes will be in control. So only we will follow exercise therapy. We will not follow diet and pharmacotherapy. It will not happen. So we should follow the diet therapy and exercise therapy and pharmacotherapy. So integrated approach should must be there in diabetes. Then, so today's topic is about yoga for diabetes. Till now we have seen what is diabetes, what are the types of diabetes, what are the symptoms, how yoga helps in diabetes. So yoga has considered all aspects of diabetes, physical, emotional, and the mental level of well-being. Regular practice of yoga and controlled lifestyle reduces diabetes. Yoga helps to achieve control over mind and behavior. So this we all know. So we can control our mind and behavior with the help of yoga. One can easily control food habits and change lifestyle to reduce this diabetes. So this should be going hand in hand. That means control of food habits, change in lifestyle, and yoga. This can reduce us the diabetes easily. Yoga has an important role to play in treatment of diabetes. So some of the yoga asanas I will show you next slide. So these techniques affects the body, internal organs, endocrine glands, brain, mind, and other factors concerning body-mind complex. So there are some asanas are there, some techniques are there which can control all our internal organs. Various yoga techniques can be practiced effectively to reduce the weight and achieve normal healthy condition of body and mind. Yoga positions or postures are especially useful to reduce the fats in various parts, especially the forward bending, twisting, and backward bending asanas help to reduce fats near abdomen, hips, and other areas. Yoga practice of asanas improve functioning of internal organs. It can strengthen heart, lungs, kidneys, excretory system, and also reproductive organs. Regular practice of yoga builds strength in muscles. Asana can be practiced with fast speed like exercise with good effects. The practitioner may increase the repetition instead of maintaining asana for a long time. So each asana, how many times we have to do, that also we'll be explaining in the following slide. Next is, so what are the role of asana? So why we have to do these asanas daily? So it should be in practice in our life. It should be a part of life. So daily in the morning you have to do these all these asanas. With these asanas we can reduce the complications which are getting from diabetes. So these asanas increases blood circulation. And second thing, asana will do smooth rhythmic massage to internal organs. And asanas maintain balance between sympathetic and parasympathetic nervous system, and also it decreases stress. So for all this, so oxygen should be supplied to the cell. So by doing the asanas, the oxygen can be supplied to the cells, which can increases the blood circulation, and also it can maintain the balance between sympathetic and parasympathetic nervous system. Some of the asanas I am showing you. This is the Ardha Matsendra asana. So to do this asana, first we have to sit straight. Okay, so we have to sit straight, rotate your head to other side. So once you will come into the practice of yoga, you can come to know what is Ardha Matsendra asana and how you have to do it, how to go for inhale and exhale also. So next one is Paschimottama Asana. So first you have to sit with the back straight and in long sitting posture. Stretch both your legs in front of you after sitting down on an yoga mat. So first inhale as you raise your hands over your head and stretch upward, and then exhale. When you exhale, you lean forward and touch your toes. This is the second asana. Padmasana, we all know this Padmasana. It is also known as lotus posture. So any asana, you have to sit straight with your spine straight and relax your shoulders and sit in the cross-legged. Place your hands on your knees. So in this posture, we can use any one of the mudra. So or we can keep our hands one after the other, or we can follow the Chinmay mudra, and we can do the inhale and exhale. So what is the use of this Padmasana? It increases awareness of body and breathing, and it increases the concentration. It provides good stretch to the legs, so as we fold both legs, and increases blood circulation to the abdominal area. Next asana is Sarvangasana. It is very difficult to do for elderly people and also those who are having age more than 35 years. For them, they can modify this asana just raising the legs and touch the wall also. So doing this Sarvangasana, so the varicose veins which are present, we can improve the circulation for the varicose veins also. Next one is Halasana. It is also known as plow pose. And this asana is also a little bit difficult for the people who are more than 35 years of age and also 40 years of age. So this is this one more asana, plow pose or Halasana. And next one is Matsyasana. So Matsyasana, so here first you have to lie down straight and then hold your legs and lift your hands. So these asana, it stretches your hip flexors, hip region also. It tones abdominal and pelvic muscles and also helps in maintaining the posture of our body. And also it will maintain the oxygen supply to the lungs also. Matsyasana. Next is Bhujangasana. This is very easy asana. Everyone can do. These are the some of the steps we can do the Bhujangasana. So it is used to enhance the flexibility of the spine, and also it boosts the digestion and it improves the circulation also. The Shalabhasana. So this asana is contraindicated for who are having weak heart problems are there, and those who are having hernias, they should not do. Apart from them, the other people can do it. So here it releases the tension over the pelvic region, this asana mainly, Ardha Shalabhasana. So this is the position. So it will strengthen the legs, it improves the posture, it strengthens the spines, it stimulates the abdominal organs, and it reduces back pain and those who are having sciatica pain also. It relieves stress and it calms the mind. Shalabhasana, it is also known as locust pose. Dhanurasana. So these are the some of the postures how we can do. These are the one by one step how we can do Dhanurasana. So what are the benefits? It improves digestion, it improves function of kidney and liver, it improves the posture. Also, those who are having the respiratory disorder also we can do it. And those who should not do, those who are having high blood pressure and those who are a lactating women, they should not do this Dhanurasana. So each asana it is done for about 15 to 20 seconds. The Chakrasana, half moon pose, it is also known as. So it is done to maintain the posture of spine also, and it stretches the thoracic region, shoulder region, and also the abdominal region. So this asana should be done at least each and every asana it should be done for 20 seconds. Then Padahastasana. So standing and touching your feet, how much it can be done, it to be done. So it is not necessary everyone should touch the feet, even they can bend and touch the feet. Those who cannot touch the feet also, it reduces the fat accumulation around the waist. So once you bend, the fat which is present over the waist can be reduced, and it improves the digestion. It stretches the spine and also the calf muscles. So this asana, it is also done to relieve the varicose veins also. Trikonasana, one of the important posture in to reduce. Daily, if you do this Trikonasana, it is very important to pose an important asana where the liver also it can get the blood circulation. So it stimulates the improve the function of blood through entire body. So we are moving our legs, hands. So this asana it will reduces the blood pressure, stress, and anxiety, and also it will improves the digestion in the body. So because here we are twisting our body, so maintaining this trikonasana is very good asana for diabetes. Ardha chakrasana, so half wheel pose it is also called. This is also done for 20 seconds. So this is not done for who are having blood pressure and those who are having hernia. This is contraindicated. Ardha Katika Chakrasana. So this can be done by the elderly people or those who are contraindicated for Chakrasana. They can do this Ardha Kati Chakrasana. So sideways bending to halfway only, not full way bending. Shirsasana. Shirsasana can be done by everyone, but it is very difficult for the elderly people, also 40 to 45 years. For them, they can lie down straight and then they can lift their legs to the wall. This can be done in modification of Shirsasana. So Sarvangasana. So this is one of the modification. Those they cannot do this Sarvangasana, they can keep their pillow or blanket and they can do the Sarvangasana. This is a good asana for varicose veins also. Next, Savasana. So Shavasana. So this is the one of the important pose of asanas. So lying on the floor in relaxed position, closing your eyes, maintaining inhale and exhale, or breathing in or out. So this can improve sleep and cure insomnia. It reduces fatigue, it reduces pain, and it relaxes all over the muscles. It relaxes your muscles and repairs body cells also. Surya Namaskara. So these are the 12 poses of Surya Namaskara asanas. It should be done daily. So those who are having habit of doing yoga, they can do at least 10 times of Surya Namaskara. If they are not having any habit of doing Surya Namaskara, start with 3 times a day and they can increase this Surya Namaskara daily. So Surya Namaskara, it will give flexibility to entire body. So all these asanas are one side. Doing Surya Namaskara once, 3 times also, it can flexes your spine, entire body. Also stretching is done to entire body. So this Surya Namaskara, if you done, so it will give oxygen supply to all parts of the body. Regular practice of Surya Namaskara with breathing is good exercise for your lungs. So along with this yogasana, dhyana meditation is very important. So nowadays, a lot of stress and anxiety is leading to diabetes, type 2 diabetes. Meditation is one of the part of yoga. So where if you practice it daily, it can relaxes body and mind. It reduces the blood lactate level. Reduction in blood sugar level can be done. It develops deep internal awareness and it can overcome stressful situation and rejuvenation. So all these happens how? So by doing meditation, breathing in and out. If you do it daily, so the oxygen can be supplied to the cells directly. If oxygen is supplied, the energy can be liberated. So we will be active and the stress can be reduced.
Ma'am, one question.
Yes.
Just now, as you have shared about dhyan, how dhyan help to reduce the diabetes and this thing low down the level of reduction blood sugar level. Okay.
Yes.
In the same way, can you give us an one example like how yoga,
Hmm.
just take it one asana and how that asana helps to lower down the blood sugar level?
Actually, the yogasanas, what we are doing, so what I showed some of the asanas, these will stretches the muscle
Mhm.
tendon, so everything. So when these muscles are stretched, so doing inhalation and exhalation, that is breathe in and breathe out. So the oxygen is supplied to the muscles. When oxygen is supplied to the muscles, the energy is liberated. So even the man can do his daily activities without any lethargy or stupor. So the energy levels can be maintained by doing yoga. If what I will tell, if this yoga is or the asanas or the exercises, if it is not done, so the glucose levels, it will stay in the blood itself. So the cells will not take the oxygen supply from the blood. So as a result, the person will go into, that means he will be sluggish to do any activity also. Tiredness can be seen. So on doing minimal activity also, tiredness can be seen. He cannot show interest on any activity also. So this is how the yogasanas helpful for the diabetic people. So stretching of the muscle and improves the blood circulation. So the oxygen is supplied to the cells and the energy can be liberated, which can be taken up by the muscles. So the person can stay actively and do his daily activities.
Okay, thank you. Please continue.
Yes, sir. Then some of the pranayama techniques. One is Anlom Vilom. So Anlom Vilom, we know everything. Everyone will know about this Anlom Vilom. How you have to do this should be done by the yoga instructor or the yoga one who practice yoga only. They can know how to do this. So this is the type of the hand how we have to use doing Anlom Vilom. So close your two fingers, index finger and middle finger. So you have to raise your ring finger and little finger. So how to close your nostrils? Inhale from left nostril, close both nostrils, then exhale from the right nostril. So this is done in the ratio of 1 is to 1 is to 2 ratio, and this should be done for about 5 times. So those who are having the practice of pranayama, they can do it easily. But those who are starting from the day one, so it will be a bit difficult for them to do. But start with 5 times only, then we can increase the count also. So how this pranayama, it stimulates, how it reduces the glucose. So by doing Anlom Vilom, it stimulates the blood glucose. So minimum of pranayama, it should be done for about 30 minutes. So there are different pranayama techniques are also there, which can reduces the blood glucose level. So left nostril breathing. So Anlom Vilom, I told right and left nostril breathing. So right nostril breathing stimulates blood glucose. Left nostril breathing, it stimulates the right cerebral hemisphere oxygen consumption carrying capacity. So one more pranayama is Bastrika pranayama. It stimulates the pancreas to produce insulin. Surya Anulom Vilom, it stimulates the pancreas. Nadi Shuddhi Pranayama, it balances hormone regulation and nervous system. I will show one by one how it should be done. So this is Bastrika Pranayama, rapid forceful breathing. So during both inhalation and exhalation, so it should be done in a forceful manner. As a result, the diaphragm works. Below this diaphragm only the liver, pancreas will be there. So by doing this rapid forceful breathing, how the oxygen can be supplied and it stimulates the liver and pancreas to secrete the insulin. The next one is Surya Anlom Vilom. So Surya Anlom Vilom, the same like Anlom Vilom only, how we have to do breathe in and breathe out through right and left nostril, and it should be done for 27 rounds. and this is done before every meal. This pranayama, those who are having high BP only, we will ask them to go before the meal. And also this pranayama helps to reduce the weight, it purifies the blood and improves the digestion also. So this is the next the pranayama, sitting with eyes, nose and mouth closed. This is also called as Brahmari pranayama. So here what we will do, so close the eyes with index finger, mouth with ring finger and small finger, and ears also. So this is the Shanmukha Mudra. So this is done for about 2 rounds. This Brahmari pranayama, it relieves stress and helps to relieve anxiety and hyperactivity. Sheetkari pranayama. So this is done. So this is done with sitting with eyes closed. Press your upper and lower teeth together. Separate your lips. Inhale through the gaps in your teeth. That means you have to intake in air through your mouth by closing your teeth, and a hissing sound will be heard while you breathe in. And then exhale through the nose. So you here inhale through the teeth, in the gaps of the teeth, and exhale through the nose. This should be done for 10 to 15 times. Sheetkari is again different from Sheetali pranayama. So in Sheetali pranayama, what we will do, we will sit straight and we will roll the tongue. So the tongue should be rolled like this. So while inhale, the tongue should be rolled, keep your straight back and crossed legs, and then you have to inhale through the tongue and hold the breath for 4 to 5 seconds with chin pressed against the chest. So when you inhale through the folded tongue, the breath you whatever you take, whatever you inhale, it will be of cooling only. So and exhale through the nose only. So inhale through this tongue, exhale through the nose. It should be done for 5 to 10 minutes. Kapalabhati. So everyone we know about this Kapalabhati, forced inspiration and expiration. So to exhale, the belly should be pumped in and out. So when you practice this in front of the practitioner, we will get you know how to do this Kapalabhati, and it should be done for about 30 seconds. A steady rhythm should be there, and start with 2 to 3 rounds of 30 exhalations. It should be done. So what happens? So who should avoid this? Those who are having stroke, giddiness, high blood pressure, hernia and gastric ulcers, they should avoid this Kapalabhati. So this is one of the general, they have done the research also, and they have showed that yoga has improved a lot and the in management of type 2 diabetes mellitus. So what are the services we provide? So first is we will provide diabetes education of free counseling. Once you will come with type 2 diabetes, first session will be of free counseling will be there, and a 12-week program will be there along with the nutrition and yoga. And every 3 months there will be HbA1c. You should have to go and test it HbA1c, and every weekend they have to check their sugar levels after taking the nutrition program. So in nutrition program there will be nothing, whatever you eat, just we will ask you to reduce your proportions, or if you want to eat sweets also, in the place replacement of sweets, what you have to eat, or if you eat sweet also, how much you have to eat. So that can be told in this 12-week program, and also the yoga, and especially the yoga for women. So we will be teaching the yoga for women. Daily sessions will be there. Along with the sessions, we will be asking about whatever the food they are taking, and some suggestions will be given to the women also. Okay, sir. So can you tell you how about your services also, sir?
Oh, sorry, I was muted. So thank you, ma'am, for taking us and showing us the power of yoga to cure diabetes. Now, what we see, like each and everywhere, every second family, someone is suffering from diabetes.
Sir.
So, how yoga can help, that is very important. We all know the benefit of yoga, but very few of us practice. And as you have shared all the information, it was really wonderful. And I would request, if someone have any questions, the forum is open for the questions. But before that, I have one question. Like
Okay.
a lot of people say that you should prevent eating rice. Rice is not good for a
Yes,
diabetic
sir.
person. But I have also heard that when we eat chapati, which is made up of wheat,
Yes, sir.
again, wheat is not good for people who are diabetic.
Yes, sir. So here in this program, what we will tell to eat the rice proportion also, it should be eaten only in afternoon, not at night times.
Okay.
So if they are eating at night times means they have to reduce the carbs, whatever the carbohydrate. So carbohydrate is the one of the richest source to increase the diabetes.
Okay.
So whatever and the proportions. So for example, I will tell. So these diabetes people should not eat banana also. Banana, if they eat banana, mango, or the rice item, the glucose level will shoot up. So what we will ask them to eat the banana in the morning time only instead of tiffin. So banana is equal to one meal. So we will ask them to go eat with one banana and then don't take any tiffin along with this banana. So if they feel hungry after 1 hour, so go with any dry fruits or fruits after 1 hour if they feel hungry. So the program will be like this. And regarding the rice, what is you have told the correct thing only. It should not be eaten at night times. So at night time when we eat, so during the day itself we will work and we will the energy can be expelled out from our body. But during night time we will go to sleep. So the energy will not be liberated from our body.
Okay.
So what will happen as a result when we eat at night times rice item or any rich in carbohydrates, our sugar levels will shoot up. So that's why we ask those whoever having type 2 diabetes or increasing glucose levels, go with go for rice item in afternoon only. And regarding the roti also, wheat item. So as you told that gluten will be there in wheat.
Okay.
So increase in gluten intake also increases the diabetes or increases the sugar levels in the body. So what we will ask them to go with two roti only or two chapati only, not more than that. And along with roti, they have to take green leafy vegetables or protein food more than eating of carbohydrates like paneer or like cheese. They should not take along with roti during night time. And all the 3 times they should not go with roti also daily.
Okay.
This can lead to diabetes in future.
Okay.
So they may get into insulin resistance and then into diabetes. So for that people we will be asking, don't go all the 3 times with roti. Go either at the afternoon or at night time and with plenty of leafy vegetables and fruits also. And also don't drink juices. So juice, when we take juice, juice is the direct sugar, it enters into our body rather than eating fruit. So when we eat fruit, no, along with the fruit, there will be fiber content in the fruit. So the glucose levels will not be raised in our body by eating fruit. By taking juice, the sugar levels can be increased because we add sugar to the juices. So, and also the sugars, the glucose which are present in the fruits also, it will be divided or it will be synthesized. It will be break down into further into sugar levels more in the fruit also. So, for example, I will tell sapota. chiku, and then custard apple. These are the fruits which are high in glucose levels. If you
Right.
eat this fruit directly, it will not increase the glucose level. If you make juice, again it will increases the glucose levels in our body.
Okay. 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 So now, if in like has diabetes, okay, then we say that in heredity also their child or their family members, they can also get diabetes. How, for example, just consider like my father, he's suffering from diabetes, okay, at some age maybe I also suffer from diabetes, okay,
Mm.
so what is the best way to prevent at an early stage?
So that is, it depends upon our lifestyle, sir. So the way of food and the way of sleep and exercise. These three things are very important. So if our we are having a family history of diabetes at 30 years of age, where we can see our father and mother, have suffered with diabetes at 30 years of age only, then we
Okay.
are at high risk of getting diabetes at 30 years of age. We can prevent it. So we can prevent it with exercises, yoga, and maintaining diet. And sleep cycle is very important. Maintaining 8 hours of sleep is very important. So all these things we can make it that we cannot get diabetes. We can prevent it also. And those who are having the type 1 diabetes, that means from the birth itself, nowadays we are seeing the child is born with diabetes only. So in these people also the hereditary will be there. There are chances the parents are have diabetes. That's why child is getting diabetes at a very early stage. But still now the research is going on. Type 1 diabetes people, their life expectancy rate is about 50 to 60 years only. By taking insulin injections, maintaining diet, exercises, they can maintain their lifestyle.
Thank you, ma'am. सर आप कुछ पूछना चाहेंगे? You have any questions?
क्या सर मैं हिंदी में बात कर सकता हूँ?
Yeah, I can understand.
हाँ, क्या है मैडम कि स्ट्रेस रिलेटेड शुगर लेवल बढ़ सकती है क्या?
स्ट्रेस से?
स्ट्रेस अगर बहुत ज्यादा हो गया तो शुगर बढ़ेगी, बाद में नॉर्मल रहेगी। ऐसा मेरे माताजी के साथ हो गया है, मैंने 3 बार देखा। लगभग 30 साल पहले मेरी माता को एक ऑपरेशन था, तो उस वक्त उनका शुगर लेवल बढ़ गया।
ओके।
ठीक, उसके बाद अभी 10 साल पहले मोतियाबिंद का ऑपरेशन था, तो उस वक्त भी उनका शुगर लेवल बढ़ गया।
हाँ,
इनिट नॉर्मल रहता है, अभी भी नॉर्मल ही है।
हाँ,
तो उसके बाद 8 8 8 साल पहले फिर मोतियाबिंद का सेकंड दूसरे आई का हो गया, उस वक्त शुगर लेवल बढ़ गया।
बढ़ गया। हाँ, हाँ।
उसके बाद फिर नॉर्मल आ जाता है, अभी भी नॉर्मल ही है। तो ऐसा
हाँ,
क्या?
ये क्योंकि ये ऑपरेशंस के वजह से होता है सर। द मेडिसिन्स, सम ऑफ द मेडिसिन्स आल्सो रेस्पॉन्सिबल फॉर डायबिटीज। आपको डायबिटीज आने का चांसेस रहता है, पर ऑपरेशन होने के थोड़े दिन के बाद ये कम हो जा रही है, क्योंकि आप सही तरह डाइट ले रहे हैं, यू आर टेकिंग गुड डाइट, इसलिए आपको नहीं हो रहा है। बट देर आर चांसेस इन फ्यूचर, जब भी उसका रेसिस्टेंस कम होता है बॉडी पे और एज बढ़ते वक्त, शी कैन गेट डायबिटीज इन फ्यूचर।
अभी
सो
वो 80 साल की है मैम, अभी वो मेरे
हाँ,
माताजी 80 साल के, लगभग 30 साल पहले शुगर लेवल बढ़ गया था, अभी भी नॉर्मल ही है, अभी कोई
हाँ,
शुगर उनको नहीं दिखाई देती। अभी अगर जाके मैं कर देता हूँ तो भी शुगर लेवल ओके है, कोई प्रॉब्लम नहीं है।
ओके सर।
ये
ऐसा है,
ज्यादातर ऐसा
लेकिन
होगा
3
कि
बार मैं बढ़ गया।
तो कुछ
ऑपरेशन
भी
के
नहीं
टाइम पे
होता
उनको
है सर।
डर,
हाँ, कुछ भी नहीं होता है सर ये इसका, but she is at chances she can get at any time, because दो टाइम ऑपरेशन के वक्त ये हमको पता चला कि डायबिटीज आया है फिर कम हो गया है. सो शी इज टेकिंग हर केयर एंड वो सही तरह खाना खा रही है इसलिए उसको नहीं आ रहा है. अदरवाइज 80 एज के सभी लोग अभी तो 90% दे आर सफरिंग विद डायबिटीज ओनली.
थैंक यू मैम, थैंक यू.
स्ट्रेस एक ऐसा बीमारी है जो और हजार बीमारियों का.
वन मोर थिंग आई वांट टू टेल, ये डायबिटीज लेवल्स डायली चेंज होता रहता है. जो भी खाना हम खाते हैं उसके वजह से ये चेंज रहता है. आज कम रहता है डायबिटीज शुगर लेवल्स, कल ज्यादा रहता है बिकॉज द टाइप ऑफ फूड यू ईट. आप कल पूरा मॉर्निंग आफ्टरनून नाइट स्वीट्स खा लिया होगा तो आप ब्लड लेवल देख लीजिए, शुगर बढ़ेगी आपका. सो द टाइप ऑफ फूड वी ईट is very important. So it will vary from day to day. That's why we will ask the patient to go with HbA1c test. So 3 months का average sugar level कितना है blood पे, वो exact accurate data है, वो पता चलता है अगर हमको शुगर है या नहीं.
थैंक यू, बहुत अच्छे इंफॉर्मेशन मैम आपने शेयर किया. एंड व्हाट आई वाज शेयरिंग दैट एंगर इज अ डोर which allow many other diseases to come.
Yes.
गुस्सा आ गया, स्ट्रेस आ गया तो और हजारों बीमारी हम लोग को कंटिन्यूस आते जाएगा.
Yes sir.
मैम जस्ट वांट टू अंडरस्टैंड कि आप क्लासेस जो लेते हैं या डायबिटीज को कम करने के लिए जो भी आपका सेमिनार रहता है या जो प्रोग्राम रहता है, उसके लिए अगर किसी को एनरोल करना है तो वो कैसे रीच कर सकता है आपको?
मेरे नंबर में रखी मैं, मेरे नंबर को आप और मेरे मेल को रखे तो भी अप्रोच कर सकते हैं. और फ्रॉम द साइड ऑफ यू आल्सो सर.
ओके.
अगर संदीप सर को पूछे तो भी वो लोग बोलते हैं.
एक्सक्यूज मी मैम. मैम मेरे एक फ्रेंड है, उसको जेस्टेशनल डायबिटीज हुआ था, लेकिन उसके बाद वो क्योर नहीं हुआ, अभी भी वो कंटिन्यू है. वो किस लिए हुआ है? मतलब अभी डायबिटीज टाइप 2 है ना वो?
अभी है मैडम उसका?
मतलब मेरे फ्रेंड है, उसको प्रेगनेंसी के टाइम ही डायबिटीज हुआ था, लेकिन डिलीवरी के बाद तो क्योर हो जाता है, लेकिन उसकी क्योर नहीं हुआ.
ये अभी इस जनरेशन में ज्यादा लोग ये कंप्लेंट बोल रहा है. पहले क्या कैसा हुआ था, डिलीवरी पे ही प्रेग्नेंट था तभी हमको डायबिटीज दिखाता है और प्रेगनेंसी के बाद चले जाता था. पर some of the ladies or some of the women what they are facing, ये जेस्टेशनल डायबिटीज के वक्त डायबिटीज जो भी दिखता है ये कंटिन्यू हो रहा है. ये क्यों हो रहा है? वन थिंग बिकॉज ऑफ हार्मोन इम्बैलेंस. सो वो डिलीवरी होने के बाद वुमेन बॉडी पे ज्यादा चेंजेस हो जाता है एंड द हार्मोन लेवल्स आल्सो इट विल चेंज बिकॉज ऑफ लैक्टेशन. हम ब्रेस्ट फीडिंग देते हैं इसके वजह से ज्यादा हार्मोन्स भी चेंज हो जाते हैं हमारे बॉडी पे. एंड सेकेंड थिंग इज डाइट. क्या किस तरह डाइट लेती है वो देखना है. अगर रिच कार्बोहाइड्रेट डाइट ले लिया तो ये डायबिटीज वैसे ही कंटिन्यू होता. थर्ड थिंग इज स्लीप. सो बच्चा पैदा होने के बाद माँ को नींद नहीं रहता, स्लीप नहीं रहता. Because of sleep disturbance also diabetes continue होता. And the fourth thing is क्या डिलीवरी हुआ है, सिजेरियन सेक्शन और नॉर्मल डिलीवरी. नॉर्मल डिलीवरी है तो 3 months के बाद एक्सरसाइजेस स्टार्ट करना है हर एक वुमेन को. वो इंडिया में हम लोग नहीं फॉलो करते हैं. और सिजेरियन हुआ तो 6 months के बाद. ये इसके बीच में क्या हो जाता है, तो हम लोग वुमेन हेल्दी रहना है बोलकर खाते हैं, वो भी रिच इन कार्बोहाइड्रेट डाइट वी विल टेक बिकॉज वी विल गिव ब्रेस्ट फीडिंग लैक्टेशन करते हैं. ये सब चीज आर वन ऑफ द रीजंस व्हाई डायबिटीज विल कंटिन्यू इन द वुमेन आफ्टर प्रेगनेंसी. सो इसके लिए इलाज इलाज है. So what is the solution for this problem? So three important things. So one is the yoga or continue exercise. The second thing is diet. Along with the diet, she has to follow some of the medicines जो भी डॉक्टर बोलता है. सो ये लाइफ लॉन्ग नहीं रहता उन लोगों के लिए. 6 months 1 year they will be asked to take medicines. So if they continue with this, they can reverse the diabetes.
मैम बहुत दिन हो गया, मतलब साल हो गया, मे बी 15 years ऐसा हो गया अभी।
ऐसा है तो ये कंटिन्यू हो जाता है. वी कैन नॉट रिवर्स ऑल्सो नाउ. 15 years 10 years हो गया, वी कैन नॉट रिवर्स द डायबिटीज. The things, 3 things she has to follow now: medicines, yoga and diet. 3 things ये follow किए तो थोड़ा complications prevent कर सकती है. I told what are the complications डायबिटीज से रहता है, वो prevent कर सकती है.
ओके मैम, थैंक यू मैम।
Okay.
This is very like dangerous kind of thing कि अगर pregnant
Yeah.
है and post pregnancy for women there
Yes.
are chances that they can be diabetes.
Sir. Nowadays, we are seeing even in students of 20 to 25 years of age, because of PCOS and PCOD, they are prone for more diabetes. इसके लिए मेडिसिन जो भी ले रहा है, इन लोगों में डायबिटीज आ रहा है. सो वन ऑफ द, ये कैसा है, एक आइसबर्ग फिनोमिना जैसा है, अनहिडन डिसीज है ये. So we are seeing many of the people who are going to death in early stages of life. This is one of the hidden disease only. अचानक स्ट्रोक आ गया, अचानक हार्ट अटैक आ गया. एक दिन में शुगर लेवल्स नहीं बढ़ता है बॉडी पे. It will take some time, some years. The glucose will be in our blood. Then only we are prone for diabetes. एक दिन आज भी हमारे ग्लूकोज रहता है ब्लड पे, कल भी रहता है. So if this glucose levels are there for some months, for 3 months, 6 months, it will leads to diabetes. वो हम लोग रिवर्स नहीं कर सकते हैं.
Then what's the best age so that we can go and get up check that whether we are diabetic or not?
Sir.
Because maybe today I am 40, हो सकता है मुझे diabetes हो.
So I recommend the people after 30 years of age, marriage हुआ है या नहीं, ये भी वो student है या नहीं, after 30 years is very important to go for blood tests. Every body screening every year they should be done. This is very important. So ये भी एक वेबिनार रखने के लिए सोच रही हूँ. So what are the important tests you have to be done after 30 years of age, male and females? ये बहुत ज़रूरत है सर, because we are seeing many heart attacks, strokes now and then. We are hearing this at very young age only. 25 years बच्चों को, students को heart attack आया है because of increase in blood glucose levels or increase in cholesterol levels, increase in BP in them because of anxiety and stress.
I think we should go for one more session where we should get understand about कि किस टाइम पे क्या क्या टेस्ट करना जरूरी है. And it was
this is
really
very important because after crossing age of 30, our body पे collagen कम हो जाता है. Collagen is the main thing to maintain our muscle strength. ये कम हो जाता है, कोई भी मेल और फीमेल, मैन इंडिविजुअल को ही. सो ये कोलाजन कम होने से ही सभी प्रॉब्लम स्टार्ट होता है, एक ना एक रिलेटेड रहता है. सो ये भागते दुनिया में हम लोग क्या करते हैं, हमारा लाइफस्टाइल. सो मॉर्निंग उठते हैं, हम जॉब को जाते हैं, फिर रात को आते हैं, एंड irregularities in our timings of eating also. सो टाइम में खाना नहीं खाते हैं और टाइम में नींद भी नहीं सो जाते हैं. So sleep timing cycle is very important. So when this sleep time, if you maintain it for 8 hours, we can prevent some of the problems in our life.
Wow. Thank you, ma'am. It
So,
was
and in order to prevent all these problems, one अच्छा solution है yoga है. Yoga, pranayama, very best techniques. I will recommend to each and every patient, though I am physiotherapist also. So exercise, yoga, pranayama, these are very free solutions for our life rather than medicines. We can prevent some of the problems in our life.
Thank you, ma'am. It was really wonderful session. What I want to add is here, prevention is better than cure.
Sir.
So if we start,
Yes, sir. This webinar is main thing I want to do is prevention is better than cure. Here we are preventing the diabetes by yoga, pranayama, exercises, and diet, and also the pharmacotherapy. Whatever the drugs we take along with the medicines, if these three go hand in hand, we can prevent the complications.
no matter if you are a mother, single, children, young, you should keep yourself healthy. What diet you are taking, the stress level, what time you are sleeping, and each and everything, so that you can prevent from any kind of disease, and you don't have to go and take medicine, because when medicine comes, it will bring different kind of challenges, health issues. So anyone, if you want to connect ma'am, we are here, we'll help you, and ma'am is there to take you through the challenges. She will bring you out of the challenges, and we will help you to live a healthy and happy life. Thank you, ma'am,
Okay, sir.
to educate us with type 2 diabetes and how yoga can cure. It was really wonderful session, and hope all our questions were answered. Thank you very much.
Okay, sir. Thank you so much for giving me this opportunity. And I will thank you mostly to Sandeep sir, who have given this opportunity. My main aim is to prevent the diabetes complication. जो भी है diabetes के लिए, because everyone are suffering with diabetes. So if you take 10 people, 9 people, 8 people are suffering with diabetes. So how the yoga is very important to our life. So this is one of the ancient practice in our India, apart from medicine. So ये इंग्लिश मेडिसिन आने के बाद ये योगा कम हो गया है. So previously we used to follow this yoga only, one of the important practice in our life. So I want to educate the people to practice yoga and pranayama techniques, which are very free. We can do by ourselves only. So prevention should be come from ourselves, not from the medicines or from anyone else.
Correct. We'll definitely keep this in mind, that prevention is better than cure, and we hope that people can connect with you, and not only men but women also, because PCOD, PCOS, this is a very common problem that women are facing, and post maternity, the issues, the stress, the mood swings, and many things happen, which again, this is the first time I've heard about the post maternity diabetes issues that women are facing. So this is a challenge in a not only in India but in many different countries, and I hope we can work together to help them to come out of diabetes. Thank you for this wonderful session. We'll meet again. Thank you very much.
Thank you. Thank you so much. Thank you, everyone.
Thank you.
Thank you, ma'am. Thank you,
The
sir.
meeting has ended. Thank you for joining. Goodbye.